Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what the pituitary gland is, its functions, associated conditions, the pituitary gland and epilepsy, and treatment options. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. The pituitary gland is a pea-sized endocrine organ located below the hypothalamus that releases several key hormones into the bloodstream. Sometimes referred to as the master gland, it manages stress, growth, and reproduction by transmitting signals from the hypothalamus to other glands. As part of the endocrine system, the pituitary gland relies on a network of nerve fibers and blood vessels to interact with the hypothalamus. It then uses these signals to control the endocrine glands and the body's hormonal response to environmental factors. The pituitary gland is made up of two major sections, the anterior pituitary and posterior pituitary lobes. The anterior lobe of the pituitary gland secretes several important hormones. These include adrenocorticotropic hormone, which stimulates the production of cortisol via the adrenal glands. This cortisol production helps regulate metabolism, blood pressure, blood glucose levels, and reduces inflammation. Follicle-stimulating hormone. This hormone promotes sperm production in males and egg development in females. Luteinizing hormone triggers ovulation in females and testosterone production in males. Growth hormone, which stimulates growth in children, helps maintain muscle tone, metabolism, and influences fat distribution in adults. Thyroid-stimulating hormone manages metabolism, energy levels, and nervous system functioning via the production of thyroid hormones. Prolactin stimulates lactation and influences fertility and sexual functions. In contrast, the posterior pituitary gland is involved in the release of hormones produced by the hypothalamus. Antidiuretic hormone, also known as vasopressin, manages the body's water and sodium levels. Oxytocin facilitates childbirth through uterine contractions, stimulates breast milk production, and helps sperm mobility in males. Through hormone release and interactions with the hypothalamus, the pituitary gland regulates several bodily functions and influences the performance of the thyroid, reproductive system organs, and adrenal glands. There are a handful of conditions related to the pituitary gland. Pituitary gland dysfunction can cause serious problems in terms of sexual development, thyroid function, growth, skin pigmentation, and adrenal function. A variety of symptoms may be observed in individuals with the following pituitary disorders: pituitary adenomas, benign tumors that can disturb hormonal release and cause visual disturbances by compression of the optic nerve. Hypopituitarism, a deficiency in pituitary gland hormones. Hyperpituitarism, an excessive secretion of pituitary gland hormones. Additional pituitary disorders are empty sella syndrome, a disorder in which the pituitary gland is shrunk or flattened, potentially leading to impotence, lower sex drive, and irregular menstruation. Cushing's syndrome, excess blood cortisol levels, which can cause weight gain. Diabetes insipidus, insufficient ADH production, which is linked to poor water retention. Acromegaly, an excessive growth hormone production that can trigger irregular bone and tissue development. The relationship between the pituitary gland and epilepsy is poorly documented. Very few articles address this topic, and a significant portion of relevant articles are over 15 years old, some dating as far back as the 1920s. A study performed by Aaron and colleagues in 2022 argued that the pituitary gland of patients with epilepsy had a lower width, a characteristic that negatively correlated with seizure frequency. This finding underlines a complex hormonal relationship between the structural features of the pituitary gland and epilepsy. Further links with epilepsy have been drawn due to a condition known as hyponatremia, a decrease in blood sodium levels capable of leading to seizures or coma. Evidence suggests that surgical resections targeted at pituitary adenomas are associated with a mild trend toward hyponatremia. However, this is not linked to an increased incidence of seizure activity. the incidence of hyponatremic seizures is sporadic and benign, as complications following surgical intervention tend to resolve themselves, without the need for invasive treatment measures. In cases of pituitary gland dysfunction, hormonal replacement therapy is cited as an alternative to normal hormone production/secretion. The pituitary gland is an endocrine gland that releases hormones that maintain key bodily functions and oversee the functioning of many body parts. Little is known about the pituitary gland's relationship with epilepsy. However, future studies focused on addressing the role of hormones in seizure genesis could pave the way for a greater understanding of this domain. To learn more about the pituitary gland, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.